we all cite his works, but also we use also your software, which is also part of my why you are a myth for me is that you are actually providing R5, which is one of the packages that I use most to do this working across cities. So it's a pleasure to have you today, and please take it away.
Thank you so much, Seban. Well, good morning, everyone. It's really a big pleasure to be here. As Seban said, my name is Rafael Pereira, and I work in Brazil at the Institute for Applied Economic Research. IPEA is a research institution linked to the Brazilian federal government. So I'd just like to give you this context because we have a very special position in the academic/policy world. We sit exactly at the boundary between academic research and policy decision-making. We are a branch of the government conducting research to inform policy. So we are all the time trying to make this bridge between publishing papers, going to conferences, and then bringing all of these new, relevant, cutting-edge methods and data into policy decision-making in the Brazilian government, which I think is very exciting and fascinating, but it comes with goods, with perks, but also it comes with a few challenges we can discuss later. So the outline of my talk today, I'll very briefly talk a bit about accessibility as a holistic planning concept. I'll then move to illustrate some of the research that I've been doing with a few examples of a broader research agenda that I have on accessibility and how accessibility cuts across the rest of the work that I do. And I'll try to spend some of my time specifically looking at one paper which is currently in progress, where we are trying to understand how accessibility shapes welfare take-up. As you guys will realize, most of the work that I'm doing here is not so directly related to what most of you guys are doing, because I believe in Seban's team, you're mostly working with mobile phone data and mobility patterns and all of that. And the kind of work that I've been currently mostly been involved with, specifically in this project that I'm leading, they're mostly related to accessibility or potential accessibility. But accessibility is always about potentiality, right? So, but I hope it strikes an accord and it brings some relevance to what you guys are doing and thinking as well. So just to make sure we're all on the same page, what do we mean by accessibility or spatial accessibility? So the way I like to illustrate this is that you can imagine a person in a city. This is the person in the city of Porto Alegre in the south of Brazil, but this could be Boston, Kinshasa, Tokyo, Paris, or New York. So in that city, you have several opportunities spatially distributed along the city. You can think about jobs, healthcare facilities, schools, universities, and in this case, we have food banks, or you can think of restaurants, for example. So accessibility is about how easy it is for a person to reach the destinations that you would like to go to. The thing is that there are spatial and temporal constraints about how fast you can travel in a given amount of time in a given city, considering where you are, where the destinations are located, and how efficient is your transport system. So in this case, using public transit, this person can only reach this area in the yellow polygon. So within 30 minutes, you can be anywhere within that yellow polygon there. So this polygon automatically tells us of all those food banks or restaurants that exist in the city, what restaurants she is able to reach and what other restaurants she's immediately excluded from. Now, there are very different ways in which you can expand a person's accessibility. And you can think about many different types of policies and interventions, but down the line, there are only two major strategies or group of strategies to expand the person's accessibility. The first one is expanding the accessible area. You're basically increasing the speed with which the person can travel, right? So you can, for example, increase the network connectivity of your transport system, or you can increase the frequency of your bus services so you spend less time waiting at the bus stop and then you can travel further, or you can just reduce congestion and get people's speed higher. When you do this, you're basically expanding the area the person can reach. There's a second alternative there, which is about proximity. It's about co-location. So you can also expand the person's accessibility simply by increasing proximity between people and places. Increasing co-location, for example, by allowing for higher population density near the CBD, or land use regulations that increase density of activities and land use peaks, for example. And as you can guess, one of these alternatives is cheaper and greener to implement, right? So this is kind of a general idea of what is accessibility and how you can actually tweak land use and transportation policies to increase people's access. When we look at the literature, there has been several papers that have been published looking and bringing relatively robust causal evidence showing how accessibility actually is really important for social and economic life. So different studies have shown, for example, that, this one, people that live in areas with higher accessibility, they have higher rates of participation in out-of-home activities, so they're much less socially excluded. People living in places with better access to jobs have a much better chance of finding a job or a job that pays better, or once you get unemployed, you spend less time unemployed and you bounce back into the labor market faster. When you build new schools, for example, closer to the students, or when you give them bicycles, for example, to get easier access to their school, you significantly reduce dropout rates, for example. So this is all about how different interventions, either in transport or in land use, are showing how people's potential access or proximity to healthcare, education, and employment, for example, actually have relevant impacts on people's life outcomes in terms of how health outcomes or employment outcomes. And finally, there has been some studies that are a little bit more correlational, showing that people that live in places with higher accessibility, they tend to make more sustainable, sustainable transport choices as well. So this is all very empirical, but from a very theoretical point of view, if you want to think about moral philosophy and theories of justice, which is one part of the kind of work that we've been doing, providing or improving people's access matters in many different ways if we want to build more inclusive and sustainable cities. So from a sufficientarian point of view, having access to grocery stores or to schools or healthcare facilities is fundamental for people to be able to satisfy their basic needs. From an egalitarian perspective, we are usually very much concerned in democratic societies about inequality of opportunities. And thinking about the spatial accessibility allows us to think about the spatial dimension of those inequalities in access to opportunities, where some social groups have systematically lower access to job opportunities, public services, for example. From a human development perspective, thinking about the Marchesson and the capabilities approach, having access to the places that you deem valuable for the life you want to lead allow you to participate in activities and develop other human activities, like take piano lessons, going to ballet or watching the cinema, meeting friends and family, for example. And finally, from the environmental perspective, high accessibility places do shape people's transportation choices toward more or less sustainable mobility patterns. So the first takeaway message that I want to leave with you guys for the first part of my talk is really about how accessibility is not about transportation. Accessibility is not about land use. Accessibility is a glue, a concept that allows you to articulate a human-centered approach to urban planning and allows us to think in a holistic and an integrated manner about housing, land use, transportation, public services, geography of opportunities, and how all of those different topics come together within the same framework of understanding and data analysis. So this is the key message for the first part. Do you have any first questions or comments so far, or we'll move to the next one? Great. If you disagree, I will ask you to leave your comments for the end. So in the second part of my talk, I'll just give some general examples of other types of research problems and questions that I've been grappling with in my research agenda. And as you will realize, accessibility is a key concept that cuts across most of the work that I've been doing. But in general, I try to situate my research agenda in this Venn diagram, where I'm very much interested in these three big topics. I'm very much interested in how theories of justice and equity translate into urban and spatial planning, how land use and transport planning and policies have impact in people's lives and social outcomes, and necessarily we need to develop a lot of tools and methods, so it comes with some data science, spatial data science analysis as well. So these are some of the papers that illustrate how most of my work is situated at some of those intersections. And very briefly, I'll just go over a few examples to show you. So first, looking at this intersection between land use and transport planning and theories of justice, myself and a few colleagues who have been publishing or engaging for a while now in a few studies that we're trying to provide some critical evaluation of what insights different theories of justice and different perspectives on moral philosophy can actually bring to urban and transportation planning. And we're trying to situate how different theories of justice and planning theories of justice as well can actually be articulated to think about distributive justice, democracy, and diversity in the context of transportation planning. This one is a paper we did mostly focusing on land use and transport planning, not so much on justice, but you could make the stretch. We had a fantastic quasi-natural experiment in Brazil in the year 2022. So in the national elections in 2022, for the first time, a few dozen cities provided free public transit on the first day of the election. The Supreme Court decided that every city in the country should provide free transit on election day. So on the second round, all of the municipalities provided free transit. So we wanted to understand to what extent providing free transit on national election day would actually increase voting turnout. So we were looking at two different data sets, administrative records with voting turnout rates at the voting pool level. And we were using mobile phone data aggregated from Google. This was kind of still, Google was still publishing the public mobility data. And we found a very interesting but contradictory result. We found no effect on voting turnout whatsoever, but we found substantial increases in participation or mobility activities in transit stations, parks, grocery stores, retail, and a small reduction in residential. So the first puzzle we had is what the hell was happening? Like what could be explaining this kind of unintuitive result? I was really expecting, actually, the first time we saw the results, I was like, this is wrong. This is not working. But after many robustness checks and analysis and heterogeneity analysis we checked for low income and high income neighborhoods, low density, high density neighborhoods, and the results were all the same. Voting turnout rates were not being affected at all by free transit. So we spent a lot of time in this paper trying to discuss what could explain that contradiction. And there are at least 3 or 4 different explanations, but the two most important of them is that voting in Brazil is mandatory. It's not like in the US. If you don't vote, there are sanctions. The sanctions are not that strong, but there are sanctions. But I think most importantly, the voting system in Brazil is planned to maximize accessibility or to minimize distance. So you're always assigned to a voting place that is close to your home. If you move residence and if you change city, for example, you can reassign yourself to a different voting place. Many people do not reassign; they usually keep voting in the same place forever. But as a rule, people usually vote very close to their home. So the main barrier for voting participation or democratic participation in elections in Brazil were not really the monetary costs. It's mostly about physical, geographical distance. So sometimes the whole discourse about providing free public transit to increase social inclusion needs to be taken with some pinch of salt, because sometimes for certain activities and social demographics, is not necessarily about the monetary barrier, sometimes about the physical barrier. The second reason why we might not have seen such a big change in turnout rates is that the 2022 elections were one of the most politically polarized in the country's history. Back then, we had Lula, the famous leader in the Labour Party in Brazil, running against Bolsonaro, who is also known as Trump of the tropics. So that was the most polarized election we had seen so far. And political science studies have long established that in very tight elections, people consider their votes to have more value and to be more important. So they're less willing to not show up to vote. Now moving to the intersection just between transport and land use and spatial data science, a lot of the work that we do involve crunching loads of data or coming up with new methods or bringing new methods to R and make them more easily and publicly available so people can use them. So a lot of the work that we do to operationalize and implement the research projects that we have requires developing computational packages. So we have been developing over a few dozen packages now, mostly in R, although there are 2 Python packages in the middle. Some of these packages are used to geolocate and georeference home addresses in Brazil. We have been geolocating every address of every administrative record of the Brazilian federal government for every single year. So we have already geolocated over 1 billion addresses for the past 10 years. It would not be possible to do this with Google Maps or ArcGIS license because it would be too expensive, it would take too much time. But with Geocode BR, you can do this in a couple of hours. Well, you can geolocate 40 million addresses in 15 minutes for free. The level of spatial precision is pretty accurate compared to Google Maps and ArcGIS. And even if we only find 80% of the home addresses with a precision at the most 1 kilometer, now you don't need to send all of those 440 million addresses to Google Maps. You only need to send 20% of that. So I would love to spend talking about all of these packages. I love each one of them, but I won't have time. So I just wanted to mention one of them, which I think is perhaps more relevant to the kind of work that you guys been doing here, which is R5R. So R5 stands for Rapid Realistic Routing on Multimodal Networks. That's a software, it's a Java engine for routing on multimodal transportation networks, combining walking, cycling, public transport, cars, and all of these just different transport modes combined. And R5 is perhaps one of the most powerful, I think probably the most powerful multimodal engine for public transport and accessibility and routing analysis. And it was developed by colleagues in Conveo at Washington, D.C. The problem, though, is that R5 is written in Java. And Java is not a computer language that many of us speak, especially in urban planning and transportation planning. So we came up with R5R and R5Pi, which are basically R and Python bindings, so you can run R5 locally in your laptop. So what used to take me during my PhD in 2015, 17, it would take me with OpenTripPlanner in a very powerful computer running parallel. I would run OpenTripPlanner for like the weekend, like the entire weekend running to calculate travel time matrices for the city of Rio de Janeiro with a few hundreds of millions of origin destination pairs. Now with R5, this takes you a couple of minutes. So R5 is really a fascinating and powerful tool. It allows you to calculate really million scale origin destination pairs, travel time matrices, monetary costs, considering terrain elevation and level of traffic stress for cycling and many other interesting capabilities in a very efficient way for free in your laptop. One of the nice things is that this package is now getting close to 1 million downloads. So I would never imagine that a paper that I publish will have, let's say, 10,000 citations, but having a package with 1 million downloads is quite nice. And this package specifically has been a really interesting take-up of it because it's now being used by the National Statistics Office in Canada to generate official statistics of access to employment, public services at the city block level for all of the country. Some colleagues in the country of Wales are also using R5I to estimate access to healthcare. Brazil is moving some way. We're trying to move in that direction to get the Brazilian Statistics Office to use this as well. So we are seeing that R5 is becoming very popular, not only in the academics realm, but also within policy and decision making, which I think is very gratifying to see. So another work we did recently, this was a collaboration with colleagues in Germany, and we were looking at, in the city of Rio, how there is an urban violence penalty to access schools in the city. So this is kind of a two-step project. The first step is this one, where we combined official data on crime records, crowdsourced image on Google Street Views with people's perceptions about what streets are safer or not safe, using the Place Pulse dataset as a kind of a basic training line. And we used crowdsourced data on shootings. This is a very bleak reality in some cases, but in Rio, there is an app which is very popular, that if there is a shooting happening nearby, like with stray bullets and there is a conflict with gangs or whatever, you can go on this app and report there is a shooting right now happening at this location. So we combine all of these three different data sources to downscale crime, an index of a crime index at the road segment level. So we have here for every road in Rio, what is the criminality or the crime index in that road segment. Then with routing analysis, we estimated what is the shortest route for each kid to walk to the nearest school near their home. So here in this example, you have a favela here. The kid lives here, and here's the school. So one option, the shortest option, would be just to walk down the red path to the school through the favela, and every red dot you see is a criminality, or it's a crime incidence, right? So you have some level of exposure, a high level of exposure to criminality right next to your home. So you travel much shorter, like less than 18 minutes, but you're exposed to a much higher level of criminality. Or the alternative, you could take a detour, which is much longer, but you'd be much less exposed to criminality. So we did some analysis looking at how different neighborhoods in the city and how to what extent the kids' population in Rio would be more or less exposed to criminality on their way to school. Again, this is not mobility data. We would love to have mobile phone data tracking students to see what their actual behavior, what do they actually prefer to do, how is their elasticity or tolerance to criminality. But because we don't have that information, this is just like potential of what would be their exposure if they took one of these two alternatives, right? In a different study, we also looked at how in the city of Surrey in Canada, we got data on population projection, or the forecast of urban growth in the city, what neighborhoods are going to grow the most, and what is the change in the demographics of different neighborhoods in the city. And we're trying to understand, if we keep the supply of schools and hospitals as they are today, just with this projected population growth and demographic changes, what will happen with supply and demand of public services? What neighborhoods will be strained or have oversupply or short of supply when you think about access to the services? And in this particular case, we use a more sophisticated accessibility metric that looks beyond simply whether you can access the service, but also how many more people are also accessing the service. So you can think about accessibility, a competition in accessibility, in the sense that many people will use the same service as you, so there will be some congestion at the destination. You might live just 5 minutes away from the hospital. If that's the only hospital in the city where you live, pretty much everyone will go to the same hospital. So it's not just about the physical proximity, it's about the availability of the service as well. Like if you have a UCI bed, for example, in COVID-19, this is a very relevant problem we used in another paper as well. So now, I wanted to move to another example that I think sits at the core of that Venn diagram. And this is a paper that is very much work in progress. In this image that was generated with AI, so this is not real, but it looks pretty real. It illustrates some interesting patterns. There's like very clear segregation pattern between the informal favela city and the formal city across the river. But I'd like to draw your attention that this is a social welfare reference center. So in Brazil, we have a welfare state that provides subsidies for utilities, like let's say electricity bills for low-income individuals. We have conditional cash transfers, called the famous one called Bolsa Família, where we transfer money for families to keep their children in school and being vaccinated. We have social housing policies that we subsidize housing or housing refurbishment or building social housing. And I could go on with many other social policies that we have. For pretty much most of the social policies in the country to become eligible to these policies or to receive those benefits, you need to go in person or need to receive a visit at your household from a social assistant. And these reference centers are the geographical places where you need to go to, or where the teams are actually based. And so they go to your home from there, right? So we are trying to do, we're doing this project in collaboration with the Ministry of Social Welfare in Brazil, and they wanted to understand three things. The first one is, where are the welfare deserts in Brazil? Where are the poor people living, and specifically the poor people that are living too far away from these reference centers? Second, if they wanted to build and expand their welfare network, those reference centers, where they should build these new centers to expand capacity and expand the coverage of the population in the most efficient way. And third, once you open a new reference center and you're basically increasing people's access and proximity to these reference centers, what is the actual impact in getting more people registered in the national registry? One thing that I forgot to mention is that you need to go to one of these places to be registered in the national registry. We call it Cadastro Único, which is the unified national registry of the populations and families under vulnerable conditions. So need to be registered in this registry to be eligible to those policies. So the questions we have here is really trying to understand how does expanding the physical accessibility to those reference centers would actually impact the welfare coverage among low-income individuals in the country? How can we think about the spatial planning of these reference centers and the locations we place them to improve the targeting and coverage of these social policies? And how the opening of these reference centers, do they actually improve access for whom, and not only improving access to the reference center itself, but does it actually improve access to the social policies also? So the motivation here, I already briefly mentioned this a minute ago, is that the social assistance reference centers, they are the front line of Brazil's social assistance system. They are the key gateway for the National Social Registry, or the CAD Único, which determines the eligibility for social programs like the conditional cash transfer, housing, and utility discounts that I mentioned. And these reference centers, they are mainly, or basically fundamentally publicly funded, and they are neighborhood-based. So because these reference centers, they will require an in-person visit and periodic updates, the physical distance to those reference centers, they actually become a meaningful barrier to social policies. And I mentioned you need to register at this reference centers, but also you need to keep updating your data at least every other year. If you stay for more than 2 years without updating your information, you get removed from the registry and you probably lose your social benefits. So what we're doing here, the question in practice we're trying to look at is, when you open a new reference center in a given location, do more families that live in that area enroll in the CAD Único? And do families that were already enrolled, perhaps, would they update their records more? So we are using the identification strategy we're doing here is using a staggered differences and differences analysis, because these reference centers, that are being opened in different moments in time. But they open in different moments in time. So basically what we're looking at is a location that has already received a reference center. This is our treatment group. Locations that have not received the reference center yet, but we know they will, they are our control group. So we are only comparing locations that have received the reference centers or that have not received yet. So we are doing this analysis for all of the Brazilian municipalities in the period between 2011 to 2019. As you can guess, we are not looking at data after 2018 because COVID-19 really screwed up the policy and the data. We might be able to look at more recent data since 2022 or 23, but this exercise here is only for this period. So just to illustrate what I'm talking about, imagine you have a city, and in this location, there is no reference center yet, but we know it will receive a new reference center. A new reference center will be built here in 2 years' time. So we track each dot is a family that is already registered in the National Registry, and we know where they live, and so we know exactly where the families that are registered live every single year, before the reference center is opened and after the reference center is open. So what we would expect is that after you open those reference centers, you will identify more families living nearby. So here you have families that are under the radar. They're either living here, but they're under the radar, they're not registered yet, or they're living somewhere else, they eventually might move here. This is a topic we can discuss later. So we do this analysis considering different radius as a sensitivity analysis, and we do this combining all sorts of different data sets. We combine satellite imagery data to get topography or elevation data. This is very important for the routing analysis of how far it is for you to walk and access those reference centers. We've been trying to work with the household census survey, but it's very outdated from 2010, and the latest one from 2022 has several problems with the income information. But most of the work that we are doing is basically combining and geolocating reference centers and households of the families registered in the CAD Unico with the packages we mentioned before. And using R5R, we are calculating the travel times and distances along the road network in OpenStreetMap. So here's the result. On this chart, this is a typical result that we have for like a differences in differences regression model. So basically what we are comparing is how many families you have registered in this area that have already received the reference center compared to an area that has not received a reference center yet. The two colors are basically two different estimators or regression models that we're using. They have relatively different parameters underneath. And because the results are just pretty much well aligned, it just gives us more confidence that the results are quite robust. So on the x-axis, you have the time, the relative time to the opening of the reference center. So 0 is the year when the reference center was opened. The year before is used as a reference. So here we have 0 families registered there. And the values you see before, 1 year before, 2 years before, 3 years before, is basically telling us that the difference between these two places are statistically irrelevant, which means that the treatment and control area groups that we are comparing, they're really comparable and we have parallel trends. They used to behave in the past exactly the same way. Once the reference center kicks in, the difference between the place that received the reference centers and the locations that have not received the reference centers yet start to show up. So just on the same year you open the reference center, you already register approximately 15 to 18 more families on that year. 1-2 years later, you start registering every single year something between 18 and 20 cities compared to the counterfactual group. But this is, remind you, this is just a very short 1 kilometer radius around the reference center. If we open this to 5 kilometers, 2, 3, 4, and 5 kilometers, it's just kind of a robustness analysis to show that the results stay well behaved in all of those cases. But naturally, the values on the y-axis change quite a lot because you're looking at a much larger area, right? So in the 5 kilometer radius, you get something close to 100 and 100 new families being registered into the system. Families that were not in the system before, they were under the radar, and now you're bringing them into the system. The same analysis is done to the number of family records that you get to update. So families that were already in the system, but you need to update the records every 2 years. And the result is pretty much the same, but the numbers change. And at some point, you also see that the results kind of flatten out. I mean, imagine you've been registering these families in a certain neighborhood for a while now. So the number of relatively poor families in that region, at some point, you have already registered all of them, or you have already updated the records of most of them, right? So the results actually flat out at some point. And in this case, depending on the estimator, it actually drops a bit here at the end. So as I said, this is a very much an in-progress type of work. So any comments or feedback will be very welcome here. Some of the key findings and next steps we have is that the results we have so far provide very robust evidence that the proximity to these reference centers have actual like causal effect in improving poor people's access to social services or poor people's access to the national registry. We know they're now being more and more brought under into the radar of the government. so there is very strong evidence that the opening of the new reference centers actually improved the coverage of the caso único. The questions that remain, there are several questions that remain that we want to look next, is to what extent does improving the coverage of the caso único also improve the targeting of social programs? So we have more people in the radar of the government. Do they are necessarily receiving more social policies as well? Are social policies being better targeted to the people who actually need them? And how does the influence of the local built environment characteristics might be affecting these results? Because the values that you're saying here, this is just the average result for all of the municipalities and all of the reference centers in the country. But we assume, or we suppose, that if you open a reference center in the suburbs, in a low density neighborhood, or in nearby the city center, or very close to a high population density favela, for example, these values will change quite substantially. So one of the next steps we're going to do is to do some heterogeneity analysis and trying to understand how local conditions, urban form characteristics, and built environment characteristics, and population density and transportation networks might actually be shaping or modulating these average effects into different levels as well. So that was a paper, very much in progress. So all of the comments and questions will be very much welcome. And here's the final part of my presentation, which is a future research agenda that I'm very excited about. I've been working in many other projects, but this is just one glimpse of a specific topic that I think I'm very excited about, which is trying to look beyond accessibility in terms of descriptive studies or correlational studies. And we're trying to understand how we can move from inequality of opportunities to inequality of outcomes. And here, we are basically concerned in trying to understand how variations in access to opportunities have actual impacts on people's socioeconomic and health outcomes, and thinking literally about social mobility. If you're born in a poor neighborhood with poor access to healthcare, does it affect the chances that your family will take children to vaccinate? If you live in a neighborhood with very poor accessibility and you get laid off from your company, is it harder for you to bounce back into the labor market? Does living in one of the studies that we're currently doing, for example, is when you close a school. Like, we have some problems in Brazil where some schools are closed eventually for many different reasons, and the students are having to be reassigned to a different school. What happens if you're reassigned to a school that is closer to your home than your previous school? Or if you're assigned to a school that is much more distant, which is usually more frequent? How does that affect your education outcome? And perhaps even in the future, your employment outcome? Does it affect, in the short term, your dropout rate, for example? If you're building a new subway line or a BRT, and you have to evict families from their houses and you have to relocate these families to different neighborhoods, what happens to their children 5-10 years after that? So we are trying to move away from relatively simple correlational studies that are just calculating accessibility and seeing how things are correlated, and trying to understand on the long term how these accessibility conditions actually affect and have a causal effect on people's life conditions. As a side, I'm very excited about continuing the Access to Opportunities project that we have in Brazil. We're building access to opportunities estimates. So we're estimating access to jobs, healthcare, and education and welfare at the city block level for all of the Brazilian largest cities by transport mode at different times of the day for every social demographics. And we are making this data publicly available for all of these cities. We're now expanding the project to cover 50% of the country. And this is like a huge effort in just building a public data set that becomes a public good that policy officials, governments, researchers, and students are able to use in their own work. So this is an R package we developed where you can just very quickly download the data. So if you're an R user, I guess many of you are here, with one simple function, you can just call read access for the city of Curitiba for public transport in 2019 in the off-peak period, and you get the geometry of the observations. And with one ggplot call, you make a map like this. Is this the most beautiful map you have ever seen? Not really, but I think it's very, very powerful to think that with two very simple calls of code in a very simple language to understand, a local policy official or a student can create a map like this. And you can, even if you're not familiar with the city of Curitiba, you can look at a map like this, you can kind of guess where is the city center? Where are the main BR3 transportation corridors? So it's very empowering to see how the tools we are developing are in some way helping more students and researchers and policy officials to have better access, easier access to better data. In a way, we were trying to democratize spatial data science and make them publicly available. And again, this is just one R package, and it already has 28,000 downloads. I don't have 28,000 citations, but I have 28,000 downloads. I mean, I know these metrics are totally different. They're not comparable, but I just like to make fun of this because when we talk to academics, and as I said, I'm kind of a hybrid academic, we are usually obsessed about publication of papers and citations, but you can actually broaden your horizons and think about your academic and social impact much beyond just publications. Obviously, I like to get published, and I really like to get the citations we get. But at the end of the day, having impact in these other different ways can be much more powerful as your life impact in way where you live. We also have some interactive data visualizations. This was actually built in 2018, 19. So this is actually very outdated. With MathGL and other packages by Kyle Walker and colleagues, I'm sure we'll be able to make a. This was like cutting edge in 2019. We were using MapDeck, but I'm sure there are much more faster tools today. And this is all part of the Access to Opportunities Lab that I lead at IPEA. We have, you can go on the website, you can download the data directly from the website or find information about all the packages we develop. All the publications are ungated and publicly available with the PDFs there. We have more information about the projects we've been doing in collaboration with Uber, with the different parts of the Brazilian federal government. And we have a wonderful team of collaborators and former collaborators, which include students that I supervise, or that I co-supervise in different universities, including Berkeley, MIT, Toronto, Brazilian studies as well as students as well, and some of my folks at the Institute for Applied Economic Research. And that's all I have for today, but I hope we do have some interesting discussions and questions next.
Okay, thank you so much. Well, okay, it's lots. Questions for Rafael? Yeah, please.
Thank you so much for the presentation. And I have one comment for the final project that you were working on. So I can see that the impact of building up a new registration center will be like saturated in 5 time slots or so.
Yeah.
Is it like, I'm just thinking whether it's more like better to have some rotating this registration card, like blood donation cards, so that if you're in a simulation, maybe it's possible to show that at least, for example, 10 cards rotating around the street, and will effectively like satisfy the upgrade of the registry.
Sure. Actually, that's a very good point. And that's probably a message that I should take to the Ministry of Welfare more than a research question. But absolutely, from a logistics point of view, that could be a very interesting solution. The thing is that I would need to know a little bit better what is the reality at the ground level about these reference centers, because they provide advice to a number of people and several services there. So I'm not sure to what extent the physical offices they have would be completely replaceable by cars. But one thing that I know for sure is that they do have active search teams. So you can, in this registration system, you can either go and visit the reference center, and in that location, you need someone from the reference center to eventually go to visit your home anyway, or you just receive a visit from the reference center directly at your doorstep. And this visit at the doorstep is very fundamental, because two things. One is this national registry collects a lot of information about your living conditions. So they actually collect data about how is your household, what is the material that you have on the walls, you have a bathroom, how many people per bedroom do you have, and this kind of information. So this needs to be validated locally. And the second reason is that this is a way to validate the quality of the national registry. Think that almost all of the, or at least the major social policies in the country are heavily dependent on the national registry. It's quite common that every year we would have at least one or two cases of misallocation of resources or corruption, where you have the son of a mayor receiving some social benefit. This goes on the news and it's a huge splash. And a lot of people start questioning the legitimacy of social policies. You don't want to, for social policies that are so critical for the lives of low-income individuals and vulnerable communities, you don't want to risk that. So having social assistants that go inside and verify and check the living conditions of the people they're registering is really critical for the quality of the data and for the legitimacy of the social policies as well. But yeah, so the mobile teams, they exist. We probably should have a better look at the data to see which ones are already using it and to what extent. But the data quality that they have is not super great.
I also have another question since we come back to the crime, how the crime is impacting the children's.
Yeah. This one.
Also, I'm wondering, because those crimes are happening from time to time, so that's a timestamp. So
yeah.
Simulating the travel is on all the crimes happening.
Yeah, so this is kind of the accumulation of all the crime incidents that happened. And you're absolutely correct. Maybe that crime incident was isolated, there is no correlation, whatever, it was just happened one moment in time. And maybe that neighborhood is not that, let's say, that risky. So we couldn't really have matched the temporal aspect at a very fine spatial scale. So that's why we accumulated all of these crime incidents to come up with the index. So it's kind of like you're capturing places that are chronically have higher level of crime in the area. Sure.
Yeah. Thanks for the presentation. I was wondering if you could just talk about your role, the interface between the academic side and the policy side. And in some of our work, we've gone and worked with the city of Boston policymakers. They have a whole different vocabulary, how they describe things and what their priorities are.
Yeah.
I think we can probably.
Yeah. So it's.
Talk. Yeah.
Yeah. But that's a very great topic, because I guess when I was doing my PhD, 9 out of 10 seminars we would have other academics coming in. And I'm kind of this hybrid animal that are kind of in between, lost in between both worlds, right? And in a way, that's kind of an interesting topic, because some of the work that we do is really academic. Like this work that we've done, this paper specifically, it was not related to the public officials at all. So not all of the studies that I'm presenting here were actually requests from the government. But a lot of the requests that we receive from the government require us to develop tools that we eventually apply in the academic papers. Or a lot of the requests that we receive from the government will eventually be transformed into an academic paper. So one of the most stressful examples that I have, like last year in 2024, there was a huge flooding in the south of Brazil. Like 75% of the state of Rio Grande do Sul was hit by floodings. And the government created this emergency cash transfer program. If you are a worker working at a firm that has been affected by the floods or the landslides, you're eligible to receive a minimum salary for 2 months. And the government, they simply created this program. They did not ask us. It's their mandate. They do what they want. They were elected. But after they created the program, they asked us to identify, okay, who is eligible to this? Who are the workers that should receive the funding? So we were required to come up with some tools and geolocate all of those firms and the workers. And in the end, we sent back to the government the list of the names, addresses, the spatial coordinates, and the IDs of the workers that were eligible to the program. So that was like a period of 1 month, working 12 hours a day, super stressful, where we are, for the first time, having the most direct impact on what people's lives with a policy design that we were having. And we obviously were very cautious that we were very concerned, like, because this kind of analysis always have errors, right? And you always have type 1 and type 2. We know that some people that we identified as eligible might not be eligible at all because there are errors in the geocoding process and in the spatial data analysis that was done to identify the area impacted by the floodings. But there are also people that might have been impacted in fact, but we did not consider them to be eligible at all. So we were very cautious with that, and we immediately alerted the government that there are problems with the data analysis, you cannot really escape. So the government created this open channel for individuals who got affected to get in contact and claim that they were affected. And then people at the ground were checking their coordinates and interviewing people and all of that. But one of the really nicest things about this is that whenever we get this kind of requests from the government, we need data. So for example, the government recently created they expanded a policy to subsidize electricity bills for the country. So if you're a low-income individual, we can subsidize up to this amount of kilowatts that you consume every month. And they asked us, after they created the program, they came to us and asked, how much is this going to cost? They had the ballpark estimate, but they wanted like a proper, good analysis of the data. And we said, sure, we can do that. But we need to know families that are cohabiting in the same household. We need to know how much people, energy, individuals, families use each month. So we requested the data, then we received identified data of electricity bills and electricity consumption for all the families and firms in the country for a few years. And the same experience happens for different projects and requests that we see from the government. So at the Institute for Applied Economic Research, we are building this huge data lake where we are building linkages between welfare data sets and households and labor market data sets and all of that. So we can actually track over time individuals and their families and their services and relationships they have with the government and in the labor market and all of that. So it is very stressful in some cases, but it does give us a very unique opportunity to build these incredible data sets from administrative records that we would usually not have access to in academia. So, and obviously combining these data sets with other stuff, it's just superb in terms of the research potential that we can have.
More on the solution side of complex. Initial slide mentioned that easy proximity will be cheaper and greater than having more network.
Yeah.
So access to your example was about restaurants, and also you mentioned later on jobs. And the assumption there, based on all these maps, that people who live in that X style or neighborhood, we should increase more proximity to jobs or restaurants.
Yeah.
I have no idea what it is, but in the United States, there's no single neighborhood where all the academics live.
Sure.
I mean, all the universities. So which jobs would you put? And also restaurants cases, every single restaurant. Even if you make it at brand level, Starbucks is different from Dunkin'.
Sure. Yeah.
Even grocery stores.
Yeah.
So how would you make, if that's the solution, approximately
well, I think at the policy level, it's not really up to the policymaker to decide what goes where. So ultimately, I mean, there is very long-standing and accumulated evidence about how land use mix and population density and co-location proximity allows people to have travel shorter distances to satisfy their needs. It's not, which we know it's not necessarily always the case, but in terms of probabilities, you do have people that tend to travel shorter distances if they live in neighborhoods which are denser with higher land use mix. Obviously, there is a lot of issues with self-selection and spatial sorting here. We're not talking about necessarily causal analysis. But in the end, it's not so much about whether the mayor or the planning person in the city will decide what goes where, but it's about how you allow for land use how you change land use regulations to allow for more density or to allow for more land use mix, for example. I know in some cities in the United States, especially in the case of Brazil, I know this for sure, several cities have very strict land use regulations. So by law, they separate where you live and where the offices are. I live in the city of Brasilia. We literally have residential areas, fun areas, shopping areas, hotel areas, hospital areas, and I could go on and on. Areas for the embassies, areas for the government. Everything is sectorized and separated. And this is one of the reasons Brasilia has one of the lowest rates in active mobility and walking and cycling, for example, because the distances are much bigger than in a regular city where you have land use mix. So just speaking from experience, sectorizing things as it was done top down in the case of Brasilia was not really a great experience from a mobility and sustainability perspective.
But then what are possible solutions? What's the side to allow for this land use mix? What are people on the side are thinking?
Yeah, I think there are policy instruments when you're redoing the master plan of your city and you're changing land use regulations about what neighborhoods would you allow for higher density or land use mix. I think that's more into the operational side of master plans than at the strategic than at the operational level.
I think there is this ideal thing, most equitable access.
If there is an ideal equitable city,
is it even possible?
I don't. No, absolutely not. So this is one very common confusion that when you think about more just and equitable cities, that there should be an ideal city. There should be an ideally just city. And also some people, not you, but some other people confuse that by talking about just cities or equity means that everyone should have the same level of access, which is simply not the case. Most theories of justice that we discuss in the papers that we look at do not advocate for absolute equality between everyone. Just simply not feasible and viable in reality, where we have economics of scales and people have different preferences. It's not something that can be solved top down, and it's not even desirable necessarily that everyone has access to the same level of access. It's just not possible. But it doesn't mean that when you develop a transportation policy, if you build a BRT or a subway line, or if you're building a social housing program for your city, it doesn't mean that those policies have to be accountable and try to, even if marginally, direct the city towards a more equitable, less unequal society. So from a social justice and equity perspective, the least you would expect is that governmental policies, regulations, and investments, they do not privilege the wealthy and the powerful, but instead they privilege the people who are the most disadvantaged and the most in need. So you minimize inequality of opportunities. You don't need to completely annihilate inequality of opportunities, but yes, but at least from a justice perspective, the policies that we enact as a government or as public institutions, they should at least try to minimize those inequalities by lifting up those at the bottom.
I have a final question, very brief, about I was amazed to find that you have this causal impact of this social places that I don't remember the name, that the government is placing in places that have 7 years, because in 7 years so many things can happen between where you build in the center and then having the reactions. And I was thinking always about this example that people have about that if you create parks in neighborhoods, this is good for kids. Kids exercise more, they socialize more, and then they go to better colleges, and then they get better jobs, and then they leave the neighborhoods, and then the neighborhood goes up. So you have these policies that have a very positive causal effect at the beginning, but then in the end, it's very bad. And I was thinking about these 7 years in which you have people steadily register in the social programs. It's not what you want, right? What you want is that they leave the program. You want that you actually build the program, and then the business appears because there's no more need.
That's true, but I guess that's also about like accounting the fact that maybe there are two movements there, and I don't have a clear answer for that. That's a very good point. That if your stock of low-income individuals is too large, you might have people who are getting registered into the system, and they will eventually get out of the window because they found a job, but you're still registering more people because the stock of poor people is so big that even though on the long term you're getting people out of the system, you're still bringing more people into the system. So it depends on the flux, like the stock and the flux of what's happening. But I would say that there's still very little work that gives us like clear evidence about whether people in Brazil are actually moving out of welfare. There are one or two studies that came out in the past 2 years. They're looking at this panel data analysis to see to what extent children of families who received the Bolsa Familia in the past, they're better off today. So there is some evidence that this is happening. But I don't know if we're doing this at the pace and the speed that we would like.
That's fascinating. You have 7 years of this.
Yeah. I didn't think about that perspective. That 7 years after the opening, you're still registering people. But then again, it goes back to the limitation that I mentioned early in the presentation. There could be two things happening here. One is, let me go back to the map here. So this is before and after, right? So this family was already here. This one. This one was not here before. With the data we have, we don't know necessarily whether that family was living there already, but she was simply not registered in the system. She was under the radar, or maybe she moved into the area after that. And that's the limitation with the data we have, because ideally, you have population census data to know, okay, how many poor people live here? And then I count the proportion of people that are registered, but we don't have the denominator because the census data is very much outdated and is not necessarily at the same spatial resolution and all of that. So we only have the numerator of the equation. And as I said, it could be a bit of both. Our hunch is that you only need to register or visit a place like this every 2 years. So this shouldn't be a strong incentive. This incentive shouldn't be strong enough to motivate people to actually relocate their households and families. Okay, a new reference center opened. Let's move and live nearby. We don't think this is a strong enough incentive to do that. But with the data we have, we cannot be absolutely certain and exclude that possibility that it might be happening for a few cases.
Thank you. Any more questions? I don't see anyone online. So, thank you so much for your time.
Thank you, guys.